Hi, how you doing? Hope you're doing well. So for today's videos, I'll talk about mental health worker, main job responsibility, the main duty as a healthcare provider inside a psych hospital. So let's jump into it. So a quick summary of mental health worker job. So before I go into all the main duties of the mental health worker, I want to make sure you understand that your main duty as a mental health worker, your number one priority is to keep patients safe inside the psych unit that you assigned to. So let's, for example, like when I was assigned to the young adolescent or young adult and kids, my main job is to ensure that the kids, the teenagers are safe. The kids are not going to hurt themselves or hurt other people. But again, your number one priority is to make sure no one die, no one get hurt inside your psych unit. That is your number one job. Make sure no one get hurt. So that's why when you go through your training, there's a lot of like MEB, Managed of Assault Behavior, CPI, crisis prevention, intervention. So there's a lot of stuff that you will get trained to make sure that no one get hurt inside your unit. So I want to make that clear. Your number one job is to make sure no one get hurt or no one die inside your psych unit. Now, for this job, all you really need is a high school diploma and or GED. If you don't have your high school diploma, you can get your GED. And then you also need a BOS for healthcare provider. And your MEB and CPI, which I've mentioned previously, you can get that when you get hired, and the psych hospital or psych facility that you get hired at, they will train you according to how their hospital or their facility want it to be. When I was working in a psych ward, my base salary of pay per hour is $13.25. Now, again, this few years ago, so nowadays I think it's a little bit more higher. But if you work graveyard shift, right? You work graveyard like night shift. Like when I was working graveyard, it was I think 7 p.m. to 7:30 a.m. So that means 12-hour shift. So my raise, my pay raise is gonna be around $14. So I get raised 75 cents. Nowadays, I think you get your average pay is around $15 an hour. So just keep that in mind. So that's a quick summary of this mental health worker job. So let's go into the exact detail of the job duty that you can be expected. So let's talk about Q15. Now I know that some hospital, some facility, they would do Q30. But personally for me, when I'm working in a psych ward, my hospital, they use Q15. So what is Q15? So for example, right? Q15 for my hospital, so when you come in, your nurse, your charge nurse will assign you the duty of either watching the patient or different duties. But for now, your duty is to do round. Every 15 minutes, you go around the unit that you are in and you keep track of the patient. So for example, let's say I have a list of all the patients, right? Let's say my unit have, let's say 30 patients. So I have 30 paper of the patient. So every 15 minutes there will be, let's for example, let's say on the list there will be 10, 10, 15, 10, 30, 10, 45, 11. So you with that list, you walk around every 15 minutes, you check up the patient, what they are, the location and the activity, what they are doing. So for example, I will walk around the unit every 15 minutes. On my checklist, I will be like, okay, patient A is in his room, so 10 a.m. in his room, activity, reading a book. Okay, that's patient A. You go to patient B. Patient B is in the hallway, talking. That's it. And then after 15 minutes, you continue, you do the same thing. Okay, where's patient A now? Okay, patient A is not in his room. Where is patient A? You walk around. Okay, patient A is in the day room eating. Okay, patient A in the day room eating. Where's patient B? Okay, patient B is not in the hallway. Patient B is inside the room reading a book. Okay, patient B inside the room reading a book. That's how you do Q15. The reason why we do this, we have to keep track of the patient to make sure that patient is, we have a record of patient location, activity. just in case something happened, so we know where the patient was, so we could find the patient. Remember, your main duty as a mental health worker is to keep track of the patient and make sure the patient doesn't hurt himself or herself or any other person. Your patient safety is your number one priority. All right, let's talk about one-on-one observation. Okay, so number one-on-one observation is very extreme, but at the same time, the reason why we do one-on-one observation is that there's something had happened to that patient. So patient could be on SI, or patient have done something in the past that have made patient a risk to the safety of the unit or to himself or herself. So therefore, we don't want a patient to hurt himself or herself again. That's why we assign a mental health worker to do one-on-one with the patient. When you are one-on-one with a patient, that means you're literally right next to the patient. You have to have arm length. So imagine from here to here, that's your distance. From here to here, that's how far you could be from the patient. You have to be arm length distance to the patient. The reason why is that if you're too far away, something might happen. The patient might try something, and you might not get to the patient in time. Therefore, when you're one-on-one with the patient, you have to be arm length. Usually, in this situation, it's all depend on the doctor, the psychiatrist. When that happens, the patient, you as a one-on-one, you are in charge of that patient. So you follow patient around, you follow patient to the activity, to group, to eating, to anything involved during the day. Even nighttime, you have to be with the patient one-on-one. So patient sleeping, you have to be right next to the bed. Again, remember, this is an extreme case where patient have done something in the past inside a unit that warrant this one-on-one. Because remember, the patient have done something that consider safety risk. Therefore, we don't want the patient to escalate that behavior. So that's why we have one-on-one with the patient. After a few days, the psychiatrist will review the record, review whether or not we can take the patient off one-on-one and go back to the normal Q15. Again, this all depends on the chart nurse and the psychiatrist, the doctor. The next important thing is MAB or CPI. Overall, it's pretty much you manage the patient behavior and you prevent any escalation of violence inside your psych unit. So for example, let's say you see two patients have verbal arguments. Maybe the best situation is to intervene and say, hey, let's separate them out, talk them down, calm them down, because if they keep on arguing, they might escalate into violent confrontation, and you don't want to have that situation inside the unit because that could influence other patient, and that you don't want violence in your psych unit. So therefore, it's best to step in, calm them down. Again, when you go through the training for MAB and CPI, they will kind of walk you through how to talk down the patient, how to calm the patient, kind of de-escalate the situation. So I'm not going to go too much about that, but understand that you will get trained to do this. At the same time, before you get put into a psych unit by yourself, I mean, you're not going to be by yourself. There are other mental health workers and also other nurses. But before you are on your own, you will get about 2 to 3 weeks of shadowing, kind of like assisting the mental health worker and kind of learn how to work around the patient, work inside a different unit. Personally for me, when I was training, right, I was put into a different unit. So my main unit is young adolescent, young adult, and teenager. But at the same time, I was put into adult, acute adult, chronic adult, different unit to kind of have a feel of how to go about it and how to talk to a patient. I have talked to elderly, I have talked to women, men, adult, I have talked to teenager, and I have different type. You get different experience. After a while, you kind of learn how to talk to the patient, calm them down, de-escalate the situation. And I want you to understand that this is how you're gonna get trained. So don't freak out too much about de-escalate the situation, because sometimes there's some situation you can really de-escalate. So that's when you're gonna ask for help from other mental health worker, the nurse. And when that happens, usually you will have a team of people. So, I want you to understand that usually the ratio wise is around 1 to 3 or maybe 1 to 4. So inside a psych unit. So for example, let's say you have 32 patients, you're probably gonna have about 8 to 10 mental health worker and nurses inside that unit. So when that happens, like when the situation, you will have 8 to 10 people there to help you, like de-escalate situation. And if there are a situation that is too much to handle, the charge nurse will call code gray. This depends on hospital, but for my hospital, code gray is what we call the broadcast for the whole hospital to get extra help, where the other mental health worker from the other unit will come in to help to de-escalate the situation. So I want you to understand to not freak out when there's a situation inside your unit, because there will be actual help to de-escalate the situation. Okay, so the next one is group activity and group documentation. So in the psych unit, besides making sure the patient is safe, we also provide patient with different group activity, group talk session. So most of the time it will run by LPT or psychiatrist, a group directory. So it just depends on the people who will come in to talk with the patient. But most time as a mental health worker, you are there to monitor, to observe the patient, make sure no one act violent or hurt anyone inside the group activity. Make sure overall you are very much the peacemaker in that group activity, because sometimes the group activity person might not understand the patient inside your unit. So that's when you're gonna step in and kind of de-escalate the situation if something happen. So therefore, as a mental health worker, during the group activity, you should dare to make sure the patients are fine, make sure they follow the direction of the personnel who are running the group activities. I have in the past played basketball with my kids' patient. So again, as long as your charters are okay with that, you could play along with the kids. Make sure, again, when you play with the kids, make sure you don't be too aggressive. Now, again, sometimes some kids don't like to lose, so you play along with them. Just make sure when there's a situation in the activity, make sure you de-escalate it. Like for example, right? Let's say we're playing 3-on-3 on a basketball court. One kid let's say something happened, they miss, they don't pass the ball, and there's altercation, they argue. As a mental health worker, you stop everything, you focus on that argument, you want to de-escalate that situation, and you kind of a best way to go about it is to switch that focus to something else and say, hey, do you want to continue playing or you want to do something else? Because you don't want that argument to escalate into something more serious. So keep that in mind. As a mental health worker during group activity, you want to make sure everything is peaceful. And at the end of the day, you as a mental health worker, you also run your own group activity too. Again, for your own group activity, it's very simple. Don't make it too complicated. Very much as a mental health worker, your group activity is very much asking them how was your day. It's very much assessing the situation and their daily goal, and ask them if they would like to share anything that they find comfortable sharing. It's just a quick group session at the end of the day for them to share their thoughts and feeling with you as a mental health worker. Because as a mental health worker, you are spending a lot of time inside a psych unit with them. You and the nurse are the two people two group of people that they were seen on the daily inside a psych unit. So therefore, they will be more comfortable sharing their feeling, sharing their thought with you. So make sure you don't break that trust. So it's hard because you have to navigate on how you talk with the patient. So in a group activity, especially when you run your group at night, it will take time. It takes experience to get used to it. But again, like, it's not like you're gonna get thrown into it, and you get walk through it, you get trained, and you will understand how to run your group. All right, so let's talk about daily intake and documentation. So inside a psych unit, you have to keep track of the patient like daily intake for their food and drinks. So most of the time in the psych ward, you will have 3 meals. So your breakfast, your lunch, and your dinner, right? In that 3 meals, as a mental health worker, if you assign the daily intake and your documentation wise, so what's going to happen is that you get your card of your meal, you give it to the patient. After the patient's done eating, they will hand the card back to you, hand the tray back to you. On the tray, you will keep document on how much they eat, how much they drink. So for example, it's out 100, right? So let's say their entree, their main meal is they only eat like 50% of it. So you document down 50% meal. Maybe they drink all their milk or their juice. You put 100% juice. So that's how you kind of go about it with your daily intake. The reason why we do this is we want to keep track of patient calories, at the same time diet, and whether or not their mental health affect their daily intake. Because some patients that we have inside a psych ward, they might come in for eating disorder or body image issue. So that's why the daily intake and documentation is very important. Okay, so last but not least, restraint. So this is the toughest part inside the psych unit, because sometimes when the patient have an episode or a big violent situation, sometimes we have to restrain the patient for the safety of the patient and for the safety of every other patient inside the psych unit. So again, this is a controversial and maybe a tricky thing to talk about if you have been in that situation. So just a warning. Again, like I want to make it clear, we only restrain the patient according to the nurse and the doctor direction, at the same time only when it's necessary. So if the patient have a violent outburst, or when a patient attack other patient, or when a patient hurt himself or herself, that's when the restraint come in. But before we get to the restraint, we will have a kind of like a timeout where the patient, most time what's going to happen is that it's going to be kind of hard with the HIPAA situation. There's not much I can talk about, but let's just say that in my past experience, I will step in, I will talk the patient down first before the restraint come in. Because we don't want to put the patient in restraint, because there's a lot of documentation, there's a lot of safety issue about that situation. And then again, I want you to understand that I don't know about other places, but in the state of California, there's camera everywhere. So we want to make sure the patient and the staff are safe. So there's camera inside the hallway. Well, actually no, there's no camera inside the patient room and the restroom. But there's camera in the day room, in the hallway, in the nurse area. So make sure that everything is safe as much as possible. So when we step in, right, let's say patient escalates into violent episode, we will say, hey, one to go to a day room, one go to a timeout room where you could be by yourself, where you could talk. I will be there with you. I will there talk with you. Do you like to do that? Usually, most time the patient said, okay, I want to go to day room. I want to go to timeout room by myself. I want to calm down. I will walk with the patient to the day room, to the timeout room, and then I will be there talking them down, make sure they calm down. After maybe 30 minutes to an hour, when they are calmed down, they will be fine. I will walk them back to their room. Maybe the nurse will ask them, do you want any medication? They will call the doctor, the psychiatrist, talk about their behavior, talk about the medication, if they are comfortable giving to the patient. So that's going to be happen. But let's say if I cannot calm them down and the behavior keep on escalating, that's when we might call code gray. Now code gray is when we're gonna usually when we don't have enough hand on deck to calm the patient down at the escalated situation, and we might have to resort into restrain the patient. Now with the restrain the patient, again, only do this when it's granted. So only when it's something really, it's hard because again, I don't want to restrain the patient, but again, the nurse say, restraining the patient is a very difficult process because no one would want to be restrained, and the patient will fight you when you restrain the patient. So again, we only do it when the patient safety and other patient safety are in critical. So therefore, if the patient hurting himself or herself or any other patient, then we might have to restrain the patient. Again, when that happens, there are other staff involved and there's camera, so we make sure that, again, when you do the restraint, we follow the MAB and CPI training safety, so we follow all that. And then when you are restrained, the patient restrained, right? Yeah, there will be one-on-one mental health worker with the patient. So let's, for example, after we restrain the patient will be in the timeout room or in a separate room by himself or herself with another mental health worker. And during this time, you will have a new paper for documentation. So again, you also do a Q15, but at the same time, you do vital checks. So every 15 to 30 minutes, you check the patient vital. So we do 4-point and a chest restraint. So your arm and your leg and your chest, we will restrain you to make sure you don't hurt yourself or any other patient. So when that happens, right, every 15 or 30 minutes, we do vital check. So we will go and we do this, make sure that it's not too tight to the patient. Patient is still move. There's no red mark. Well, I mean, unless patient really yanking it, there might be a red mark. But then again, we document it down. We document down the mental patient mental state. Is the patient cursing at me? Which happened. Like I have patients spit on me, curse at me, like dread stuff that. So you document everything down. Again, every 15 minutes you check on a patient and say, okay, how are you feeling? Are you coming down? Again, you keep talking to the patient every 15 minutes, and then every maybe 30 to an hour, the nurse will come in, they will talk to the patient, and whether or not the patient is going to be out the restraint. So after a while, maybe the patient will calm down, then the patient will be out the restraint, then we walk the patient back to his or her room, and that's pretty much going to be it. And then we go back to normal. So that's kind of the best way. Well, the short, honestly, it's kind of hard to explain this situation. Honestly, it's hard to explain this process because it's based on different cases and different patients, because every patient is different. So with HIPAA and just patient privacy, there's not much I can say except kind of generalize it. But I want you to understand that with restraint, we only do it at the last resort. Most of the time, we try to talk the patient down, de-escalate the situation. Again, like when we do restraint, the doctor get called. We usually call code gray to get extra help. So, and there also camera everywhere when we restrain the patient to make sure we do everything correctly by the books, by the training. So most time I don't like to restrain the patient, but it's only in a case where the patient is hurting themselves. Like I have seen patients hurt themselves to the extreme, therefore we had to restrain the patient. And again, it's not something I want to do. It's happened, and I'm not gonna shy away from not telling you that if you are considering working as a mental health worker, restraining a patient is something that you will have to do eventually. So just keep that in mind and considering whether or not this job is right for you. Well, I hope you learned something new from this video. What is your thought on the mental health worker job responsibilities and job duties? Let me know by commenting down below, and like and subscribe. On this channel, I talk about my life experiences and my journey in healthcare. Well, I hope you have a good day. Take care of yourself, believe in yourself, and trust yourself, and love yourself. And I will see you again on the next video. Bye!